Hello everyone, welcome to my channel once again. My name is Ajibola Morolake. I'm a registered nurse and a midwife. If you are watching me for the first time, I welcome you to my channel. To my returning subscribers, I welcome you to my channel once again and thank you for subscribing to my channel. My channel is all about enlightening individuals, family about health condition that can be preventable or in order to manage it appropriately to prevent complication. And mostly I use my channel for women's health. And today again, I'm going to talk about breastfeeding awareness. As a nursing mother, newly delivered mother, please don't go away. Let's dive into this topic together. Breast milk has a lot of benefits ranging from promoting bonding between mothers and baby, serve as a natural passive immunity from mothers to their baby. It reduces the risk of upper respiratory tract infection in babies. It's also economical, accessible, and it promotes brain development in babies. So we can see that the benefits are so much. So no substitute for breast milk, and breast milk is the best. What are now the tips needed for a successful breastfeeding? Number one, psychologically prepare yourself for this stage because stress actually reduce breast milk production. Be psychologically prepared for this stage. Another thing is to be well hydrated. Take a lot of fluid and water to hydrate yourself, increase your calorie intake, and also you should start cleaning your breast, nipple, the areola, the pigmented area around the nipples, even from pregnancy stage, because this breast milk tends to be painful during pregnancy. So women may not be encouraged to clean it. And if this the nipple is not clean, if the areola is not clean, it may not encourage your health care provider, midwives to put your baby to breast after your delivery if the place is not clean, and you may not be able to tolerate a thorough cleaning at that period because of the process of labor that the woman has passed through. The woman may be aching and is not comfortable with thorough cleaning of the breast area. So it's better to be cleaning your breast, and it's advisable to use warm water and towel during this period. Those are the tips that you can actually engage yourself in it to actually have a better breastfeeding experience. And position is another thing. You have to sit right appropriately to encourage breastfeeding because breastfeeding take time for you to sit down. But if you are not comfortable, if you're having pain, this may not encourage you to continue to breastfeeding your baby. So during this period, positioning is essential. You sit upright, make sure that your spine is it's in upright alignment. If you are sitting on a ladder back chair, make sure you tuck in your buttock. So if you are sitting on any type of chair, maybe a sofa, you must sit down upright, uprightly. So this is essential. And for someone like me, if I'm sitting on, for instance, a, a ladder back chair, I may not be able to sit upright. But in this case, you may need pillow to support yourself to sit upright. And if you are sitting down in a place whereby when you are sitting upright, your feet will not be touching the floor. It's also advisable to use a support like a stool to support your leg so that you can sit right and uprightly so that there is nothing that will cause backache or pain during this period. There is nothing that is going to discourage you from practicing exclusive breastfeeding. Another thing is now attachment. Attachment of the baby with the breast is essential to encourage the baby to actually feed on the breast. So how can you do this is to open ensure that the babies open their mouth widely. before attempting to put your breast in their mouth. In doing this, it will encourage good attachment. By the time the baby is If the baby is having a proper attachment, the lower lips of the baby will cover the lower part of the mother areola completely. You will not be seeing that dark pigmented area, or according to your body skin type, you will not be seeing that pigmented area. The lower lip of the baby will have covered the lower areola of the mother breast completely, but you can still see some parts of the areola at the upper part of the mother's breast, and the baby mouth will just coil out. Make sure that the breast reach the floor of the baby's mouth at the junction between the hard palate and the soft palate, so that the baby will be able to latch well and be able to take adequate breast milk intake during feeding. And how you can know that the baby is having a good latching is that when the baby is content, if the baby is not getting breast milk, they will not be content within the few minutes of putting them to breast. The baby will be content, and there's going to be a period when the baby will swallow the breast, and the time the baby suck on the breast and swallow the breast milk. So you'll be seeing the movement of the baby chin as the baby is sucking the breast and swallow the breast milk as well, and they will be well content. Positioning and attachment is very important in breastfeeding your baby. And there are different type of positioning a woman can attain when breastfeeding your baby. Let's dive into the type of position that a woman can actually maintain when breastfeeding their baby. Moving on to the type of positioning in breastfeeding, there are different type of position that a woman can attain when breastfeeding their babies. Number one is cradle position. This is probably the most common type of breastfeeding position. And tips needed for this position is that the woman should sit comfortably. The woman should sit uprightly in a way that is comfortable for her to sit down for some time to breastfeed her baby. Lie your baby across your lap, facing you. Bring your baby to your ribs. You can support your baby with breastfeeding support pillow to bring your baby to your ribs. Place your baby head on your forehand. Bring the baby's nose towards your nipple and allow the baby to widely open her mouth before putting your breast in the baby's mouth. Your hand should support the length of the baby's body. Place your baby lower arm under your arm, the side that you are using when you are breastfeeding your baby, and check to make sure that the baby's hair, shoulder and hip are in a straight line. The baby should not lie zigzag. The hair, shoulder and hips of the baby must be in a straight alignment. Moving on to the second type of breastfeeding position, the football holding is a good position to attain after C-section to keep the baby away from the incision site. It's good for women with larger breasts, good for women with flat nipples or strong letdown, and it can also be used in women with premature babies. In this position, you sit comfortably on a bed or a sofa. Hold your baby beside you with their back resting on your forearm and bring their heads towards your nipple. Support your baby head with your open hand, holding the base of the baby's neck. Support your breast with your other hand in a C-shape hold.
Guide your baby mouth to your breast. You can use a pillow to support your baby. Moving on to side-lying breastfeeding position. This position can be used when the mother feels the need to relax during breastfeeding. It is advisable to use this position when people are or another person is around to check on the mother and the baby. It is also advisable to be used in older babies who are able to control their neck. In this position, you lie down next to your baby with your stomach lined up near the baby's head. You can use a pillow under your head. The pillow should not near the baby's face to prevent any risk. Slide your baby up so that their nose is level with your nipple and your arm is above the baby's head. Don't rest baby head on your upper arm. Let your baby lie with their side, pulling their hip close to your own hip. Your spine and your baby's spine form a V shape. You can put a cloth or flannel behind your baby's back to support the baby and prevent them from rolling away from you. Moving on to lay back breastfeeding position. This is a reclining position that is helpful for newborns. You lean back but not flat on the baby. Prop yourself up with a pillow so that your back, shoulder and neck feel supported. When you are comfortable, place your baby on your tummy. Let the baby rest on your tummy and direct the baby's mouth to your breast. If you had C-section done, you must ask your healthcare provider if you can be propped up after the delivery of your baby, because if spinal is being used for your C-section, they may advise you not to raise your head until when they inform you that you can use this position. Moving on to the cross cradle position. After sitting comfortably, bring your baby face closely to your ribs. Support your baby body with your left hand when feeding on the right breast. And when the baby is also feeding on the left breast, you use your right hand to support your baby's body. Support your baby head using an open hand. Place your thumb on the boning area under the ear of the baby to gently guide the baby's head. Bring your baby up to your breast so that her top lip and nose are in front of your nipple. Use your forehand to maintain a straight alignment, to put the baby in a straight alignment. Let the chin of the baby press into your breast. Allow the chin of the baby to press into your breast and head tint for a good latch. This is all about cross cradle position.
How can you now preserve breast milk if you are not with your baby as a working class woman that return to work after the delivery of your baby? Though WHO and UNICEF are emphasizing a supportive working place to support breastfeeding in nursing mothers. But studies have also shown the ways that a woman can actually preserve their breast milk. This supports continue well breast milk production, and it also relieves the woman of pain. The woman can experience pain if the breast is filled up with milk, and this can actually cause pain. So what you're going to do is to get a breast pumping machine. You can get a portable one, a handy one that you can be using at your working place. You can have a designated area to be doing this, have a clean container, and it's advisable to actually express breast milk in a when it actually advisable to ensure that is what the baby will be able to feed on at the time you are expressing in a container. It's not advisable to fill the baby with a leftover from a bottle again. So our study shows that a freshly expressed breast milk in a room temperature can stay within 4 hours to 6 hours. If you express your breast milk in a room temperature, it can stay within that period. You can also make use of insulator cooler with ice pack to preserve breast milk and encourage breast milk production. And studies shows that a freshly expressed breast milk in a insulator cooler can with ice pack can stay for 24 hours. If you use refrigerator to preserve breast milk, studies shows that it can actually stay unspoiled within 4 to 6 days. So you have to put this preserved breast milk, the one that the baby is going to feed on at a time, warm it inside a warm water, a bowl of warm water. It is not encouraged to actually warm a breast milk inside a microwave or put it on the fire, and also avoid burns to the baby. If you have something you can use to check, a clean thing that you can use to check the baby temperature, or you can actually use the back of your hands to check if this breast milk is ready to feed the baby. You can use the back of your hand to check for the temperature before giving the baby. Make sure you check for the level of the temperature before giving a tall breast milk to your baby to feed on. Is important. How can you now assess if the baby is well fed, if the baby is taking enough breast milk? Normally, if the baby is well fed, the baby will be thriving well, increase in their size, in their increase in their weight. Normally, within a week of delivery, baby can lose their birth weight, and after that they will catch up and thriving and increase in their weight. If you observe that the baby is not developing appropriately, the baby is not thriving well, you can actually let the expert assess your baby to see, is there any problem with the baby, is there any lingua frenulum or labia frenulum, that is tongue ties and lip tie. The baby, even you can observe that when the baby is crying, the baby will not be lifting the lips, will not be lifting the tongue when crying. That is lift their tongue, and this will affect their attachment when they are feeding on breast milk, and this can actually affect the amount of the breast milk they are taking. So the baby can be take for assessment to actually check if this is a problem or if there is any other thing. Another thing you can actually use to assess your baby is that you will be able to assess, you'll be able to assess through the changing diaper. when a baby that is breastfed, you have to change the wet diaper up to 6 and 8 within a day. By the time you are changing diapers and you are observing that the diapers is dry most of the time, you actually have to call for attention and talk to the expert about it. How the thing is that after 6 months of life, the baby will double their birth weight. But you can't wait to that period to actually assess your baby. You have to be watchful as the baby days are increasing. You have to observe if they are thriving well or not. And if there is need for the expert to see this baby, you take the baby for them to assess the baby what is actually causing the problem. Because when the baby is feeding with breast milk, exclusively fed with breast milk, everything that the baby needs is inside the breast. Don't need to give baby any other thing that is essential. Have come to the end of this video. Thank you very much for staying to the end of this video, and don't forget that breast milk is the best. Bye for now. Take charge of your health and your baby health.